Chronic kidney disease refers to kidney damage of more than 3 months duration. The early stage is usually symptomatic but can be detected through lab tests of serum creatinine and estimation of glomerular filtration rate. And also measurement of urine albumin creatinine ratio and screening of individuals at increased risk, such as those with hypertension, diabetes mellitus, or a past history of glomerulonephritis. Chronic kidney disease may manifest either as urine abnormalities, for example, persistent microalbuminuria, proteinuria, hematuria, blood abnormalities, like elevated urine creatinine and estimated GFR less than 90 milliliters per minute per 1.73 meters square. Also, structural kidney changes on ultrasonography. For all stages of CKD, as chronic kidney disease, a patient should be encouraged to cease smoking, reduce weight if obese, check lipids and treatment, and also avoid NSAIDs and other nephrotoxic drugs. The stages of chronic kidney disease are stage 1, kidney damage with normal or increased GFR. That's when the eGFR is more than 90 milliliters per minute per 1.73 meters square. And stage 2 is kidney damage with mild reduction in GFR at 60 to 89. And 3 is moderate reduction in GFR at 30 to 59. And stage 4, severe reduction in GFR at 15 to 29. And stage 5, kidney failure as eGFR less than 15 milliliters per minute per 1.72 meters square. The causes are chronic hypertension, chronic glomerulonephritis, diabetes mellitus, obstructive uropathy, renal calculi, polycystic kidney disease, toxins from drugs, herbs, heavy metals, and also connective tissue disease. So these are the causes. Symptoms: none in early stages, reduced attention and concentration, anorexia, nausea, vomiting, gastrointestinal bleeding, hiccups, breathlessness on exertion, tests, nocturia, polyuria, muscle cramps, paresthesia, pruritus, and insomnia. So the signs that are usually elicited are lethargy, bleeding tendency, pallor, hypertension, pericarditis, peripheral neuropathy, peripheral edema, hysterexis, that's flapping tremor, increased skin pigmentation or excoriation. Investigations: FBC, second blood film comment, urinalysis, blood urea, electrolyte, serum creatinine, calcium phosphate, fasting blood glucose, lipids, chest x-ray, ultrasound of kidneys. The main treatment objectives are to detect chronic kidney disease early in susceptible individuals and to control hypertension, to control blood glucose, to manage underlying causes and to prevent complications and further worsening of kidney function. Non-pharmacological treatment: to avoid nephrotoxins, for example NSAIDs and herbal medications, and daily intake of fluid of 600 milliliters over previous days urine output for adults as 400 milliliters per meter square body surface area in children. And restrict salt intake and restrict dietary protein to 1 gram per kilogram per day. Avoid potassium containing foods, for example bananas. And dialysis, refer to a nephrologist. Pharmacological treatment: to control fluid overload, first line treatment, you give furosemide oral IV 40 to 120 milligrams daily. And for the treatment of hypertension and also renal anemia, as anemia and chronic kidney disease, you treat appropriately. For the control of hyperkalemia, in adults, we give calcium gluconate 10% IV, 10 to 20 milliliters, slow IV over 2 to 5 minutes, and soluble insulin IV 10 units in 50 to 100 milliliters dextrose 50%, and sodium bicarbonate IV 8.4% as 50 MEQ in 50 ml as 1 to 2 milliliters per kilogram over 5 minutes. Do not mix calcium gluconate and bicarbonate in the same delivery system. In children, you give salbutamol, nebulized preferred, more than 25 kilograms, you give 5 milligrams, more than less than 25 kilograms, you give 2.5 milligrams. Or you can give calcium gluconate 10% IV 0.5 to 1 milliliters per kilogram, slow IV over 5 to 10 minutes, and soluble insulin IV 0.2 units in 5 milliliters dextrose 20%. You give 2.5 to 5 milliliters per kilogram per hour. You keep blood glucose at 10 to 15 millimoles per liter. And then you give sodium bicarbonate IV 8.4% as 45 MEQ over 5 minutes. That's 1 to 2 millimoles per kilogram. That's 1 to 2 milliliters per kilogram too. Do not mix calcium gluconate and bicarbonate in the same delivery system. So referral criteria: refer patients with predisposing factors and complications to a physician specialist or nephrologist for further investigative management of chronic kidney disease. Refer patients requiring dialysis to a nephrologist. Okay, so this is a summary of management of various stages of CKD as chronic kidney disease. The stage 1, the kidney damage is with normal or reduced GFR, and the action is diagnosis and treatment, slow progression of meticulous BP control, annual follow-up, eGFR, urinalysis, urine protein, creatinine ratio measurement. And stage 2, there is kidney damage with mildly decreased GFR. So estimate progression and manage as stage 1. Stage 3, moderately decreased GFR. Estimate and treat complications. If HB is less than 11 grams per deciliter, you check ferritin, and you also check B12 and folate. An annual check of serum calcium, phosphates, and PTH. I refer if eGFR is less than or equal to 30 milliliters per minute per 1.73 meter square. Stage 4, there is severely decreased GFR, so you prepare for kidney replacement therapy. Then you refer. Stage 5, that's kidney failure. So kidney replacement therapy, dialysis or transplant, and then you refer.